This is America's Heroes Group, and we are so pleased to have you with us. You can call WVON at 312-374-8130. All right? And we are globally connected with a roundtable with Kaiser Health News. And we are so pleased to have on our live line Shefali Luthra, who KHN correspondent, covers consumer issues in healthcare. Her work has appeared in news outlets such as the Washington Post, CNN Health, and NPR.org. Previously, she was KHN's Peggy Grisham Webb reporting fellow. She also interned at the Texas Tribune covering the rollout of the 2010 health law, women's health issues, and state politics. She graduated from Brown University with a bachelor's degree in English literature. How are you, Miss Luthra?
I'm doing well. How are you?
Good, good. Thank you so much. We're also joined by April Dembosky, who is a health reporter for the California Report and KQED News. She covers health policy and public health and has reported extensively on the economics of health care, the rollout of Affordable Care Act in California, mental health, and the end-of-life issues. Her work is regularly rebroadcast on NPR, and she's been recognized with awards. We could go on, but then we wouldn't have a chance to talk to her. She's a graduate of the University of California and Berkeley Graduate School of Journalism and Smith College. Ms. Dembosky, how are you?
I am great. I'm so happy to be with you.
I'm happy to have you both. This is just a great thing. I tell you, we've got some major issues going. How Obamacare, Medicare, and Medicare for All sort of muddy this campaign trail that we are hearing about. Ms. Luthra, why don't you help us with that?
Sure. So this is, I think, really interesting, really important, and very complicated, right? Because we talk about the Affordable Care Act, we talk about Medicare, we talk about Medicare for All, and very often what you'll hear from a lot of politicians is that, we either have to choose Obamacare or Medicare for All, or that Obamacare is better than Medicare for All because Obamacare has more generous benefits than the Medicare program. But these sort of all kind of conceal one of the bigger issues, which is that Medicare for All is very different from anything we've really seen in the American healthcare system. And it uses Medicare as kind of a model, but it would dramatically transform how we pay for healthcare. It would certainly be more generous than anything we've ever had. Of course, it would bring its own trade-offs. And there is a sizable constituency of Democrats who do support the Affordable Care Act, but also see Medicare for All as an ultimate goal. And so you'll often hear a lot of, for instance, people running for president and talking about how you have to pick one or the other. And it seems that that's kind of not exactly true.
So where is this going then in that case? Because in Medicare, and for argument's sake, Medicare for All versus Obamacare, it really kind of oversimplifies the issues and distracts from the policy proposals. Is that correct?
Absolutely. And
yeah,
I think one way that we can expect to see more, substantive conversation about this is this at the moment is really a conversation amongst Democrats. And we have, Bernie Sanders, who has sort of spearheaded the Medicare for All catchphrase and, led the major bill that we think of when we talk about Medicare for All. We have others who some will say, I just want to stick to the Affordable Care Act and that's it. Others say, I like some ideas of Medicare for All. I like some ideas of the ACA. I want to come up with something different. And then what we haven't really had yet is a chance for Democrats to talk about this in a segment that's longer than, a quick answer to a question on the campaign trail or in a town hall. We haven't had a conversation, and there are going to be several debates over the next year, and one, I think, even within less than a month, and there's going to be more time for people to, go back and forth and talk about the specifics and what would Medicare for All change? What would it mean for private insurance? What would it mean for the benefits that are covered? How would we talk about what you spend on healthcare and how that might change?
How's the speaker? Where is she on this?
So she defines herself as Medicare for all agnostic. She says, you need to show me how it would work. But she is definitely one of those Democrats who has argued that the Affordable Care Act is better than Medicare for all. And an argument that she makes is it's better than Medicare for all because ACA plans cover a lot of things that Medicare doesn't. But experts that I've talked to say that they don't like this argument. They think it sort of diverts from talking about Medicare for all. And there's definitely something to be said about the fact that a lot of, Democrats who are, if not closer to the center, at least trying to thread the needle between the very large swaths of the Democratic Party, right? You're more centrist versus your, far left progressives. And the more you talk about Medicare for all, the more you play into something that can be quite divisive amongst Democrats. And the more you talk about the ACA, which Speaker Pelosi seems happier doing, the more you can talk about something that the party has very clearly rallied behind and seems to a lot of observers to have helped the Democrats take over the House in 2018.
Good point. Where do you think we're going with your expertise and all that you know?
I wish I knew where we were going because I would be, very influential and very rich. Sadly, I have learned that it is better not to try and guess these things, but it does seem that no matter what, there is a very substantive conversation ahead of us about healthcare in this country. I mean, for perhaps the major reason, right, that people can't afford their healthcare. And as deductibles get higher and health plans change, people are more conscious of just how expensive healthcare is and how little of it they can afford. And that seems like something that can't really stay in place for too long.
Gotcha. Ms. Dembosky, please join us on this very difficult situation here. Everybody wants to know where we're going with this. Let us know how you feel about it. Meth versus opioids. America has two drug epidemics, but focuses on one. This is a big problem, isn't it?
Especially in certain pockets of the country. All over the country, we've really been hearing a lot about the opioid epidemic, which is a very real, very serious problem. But because we've been so focused on that, we haven't really seen something that's kind of been brewing in the background, which is a very sharp increase in the use of methamphetamine, which is a stimulant. And when you look back in history, this actually has happened several times, that drug epidemics come in waves. And so, there was an opioid epidemic in the 70s, and then we saw an epidemic of crack and cocaine in the 80s. And then it was, opiate pills and back to opioids, and then meth, and then opiate pills. And now we're seeing a rise in meth again. And so researchers who have, studied these trends aren't surprised to see a rise in meth use. But it is happening. And, a lot of people who have focused on doctors and treatment specialists who have focused on stimulants feel like it's kind of taking us by surprise a little bit, and we may not be ready just because of this hyper focus on opioids.
So what is happening here now? I mean, what is the way that the government, and you're an expert on this, and you've talked to all of these people, what needs to be done? Something's got to happen, that's for sure. I'm sorry. Go ahead.
Yeah, there's a couple things. On the one hand, from, a policy perspective, I think some drug treatment specialists would really like to see, more money being invested in treatment for stimulant abuse. A lot of money that's been dedicated to the opioid epidemic is very narrowly tied to the treatment of opioids in particular. And so I think some people would feel like it'd be great to have, more resources dedicated to this particular drug epidemic, and perhaps a broader compassion for drug addiction overall in our country. But there are some scientific things that come up, and that is, opioids and meth are two very different drugs. And so far, through the science, we've been able to come up with medications that can actually help with both withdrawal from opioids and also help stem or stave off cravings. And these are 3 FDA-approved medications, and they're very, very effective. And they are just can be a huge help in helping people who want to reduce or stop their opiate use. With methamphetamine, though, the brain chemistry is different. The reason you can have these opioid medications is because there's specific opioid receptors in the brain that can be targeted with these medications. And with methamphetamine and cocaine, they affect the whole brain. It affects, and so it's you can't target a specific part of the brain, and so it's just been extremely difficult to find a medication to treat stimulant abuse. And so, researchers are trying. They have tried a number of different things, and they just haven't found anything that really sticks.
So where do we go from here, Ms. Dembosky? There's so many people who've been on different, all kinds of, in some situations, things that are damaging. We've seen relapses are common. Sometimes you've got people, I think you would agree, trends in drugs use, they come in waves. Is that true?
Exactly. Yeah. I mean, and that's what we're seeing now with this increasing rise in methamphetamine, but also cocaine, and there are geographic differences with the within the waves as well. So, while we've seen cocaine mainly along the East Coast, it's along in the West, it's mainly methamphetamine, and then there are pockets of increasing methamphetamine use in parts of the Midwest and parts of the South, like Atlanta and Texas as well.
Meth versus opioids. We are pleased to have someone who's certainly been giving us some information. April Dembosky, health reporter for the California Report and KQED News. If you have a question or a comment, 312-374-8130 is our number. She can probably answer it. Here in Illinois, we just had, I think it was passed today, a bill that is just passed by the governor for cocaine, So I think, I've forgotten how many states have that at this point. You probably are aware. But where did we lose her? Are you there, April? We might have lost her. Yeah, I think we did. All right, maybe we'll get her back. But opioids are just ridiculous. And, of course, you know about the situation where the Illinois House, well, not the House, the legislature has passed a bill for cocaine, and there's some very, very good points in it. There's some, some things that really. April is back. Are you back with us?
I am back.
Hi,
yes.
Fred. Okay, we lost you for a minute. I was mentioning the fact that our legislature just today, ironically, the Illinois legislature just passed a bill legalizing marijuana, and the governor is or will, maybe he's already signed it. How does all this fit in your opinion? I think we're the 11th state to do that, I believe.
Yeah, and California is just recently legalized marijuana as well back in 2016, and so we're starting to see that. We're starting to see that roll out in different ways. There's, then now law enforcement has to consider, people driving under the influence and what kind of danger that may present. We see that manifesting in funny ways. We've seen dogs showing up in veterinarian offices with marijuana poisoning from, eating trash and other things on the street that are contaminated. And so, but in terms of, how that relates to methamphetamine and opioids, I'm not sure. I mean, I think some people would say, well, is it a slippery slope? Are we legalizing marijuana today, and will it be, methamphetamine or cocaine a few years from now? I think that's a pretty far way off.
Yeah, they're wondering about the trade-offs, right?
Yeah.
Right. Well, the bill here has done some good things, I think, about expunging the records of people who have been convicted of small amounts of marijuana, and it's no longer. And I think that's a good thing because, if you have that sort of a thing on your record, and it can have an effect on loans or employment and a number of other things like that. So as far as how are things that where you are relative to, you mentioned California, of course. You all have illegal marijuana, is that correct?
We do.
Yeah.
And we've been seeing, what you're talking about, like expunging, criminal records. I mean, it's a social justice issue because
right.
I don't know about Illinois, but in certain parts of California, there were you look at the records and there are disproportionate arrests for marijuana in African American communities and other communities of color. And there is there's a rectification of that social injustice. The other way we see that playing out in California is because it's legal, it's now a business. And so there are business opportunities for people who, to make money out of this industry. And one thing that's been done in Oakland, California, which is just outside of San Francisco in Northern California, is they've actually prioritized those business licenses for people of color and people who had kind of been impacted by the criminalization. And so they're sort of taking that justice issue a step further and saying, we want to prioritize this business opportunity for you.
I think that's great. In fact, I will mention what you said to a group that, ironically, I just met with this morning. It's it's an African American group, and they had some experts coming in talking about that and the business opportunities. So that's a very, very important thing. It can help a lot of people. So that's just great. How long has that been the issue in Oakland?
I think it's not very long. Maybe about a year.
Okay.
I think it was about a year ago that they passed it in Oakland as a measure.
I was going to ask if you had any idea as to how it was working out. So it hadn't been there long enough to be able to tell.
Yeah, it's early still.
Right. What was the response of the general public
to the legalization of marijuana? I mean, the way I would say it was the way that we passed it in California was through a ballot measure. And so all of Californians voted whether or not to legalize. And so, the majority won out. And so that kind of speaks to what sort of Californians wanted and think about
so
this.
Nobody can argue about that. No, that's interesting. Can you tell me the percentages for?
Oh, I'm not sure. I want to say it passed, with a very healthy majority. There was no question. But this was at least the second or third time that advocates had tried with this ballot measure. So it did take some time to get there.
And before there was a vote that failed.
Right.
Yeah. So it was not a vote. This way, you didn't put the people in the legislature on notice. They didn't have to vote on it, right?
Right. Exactly.
That's right. Well, when I tell the people here, they'll say, "We should have done that." You know what I mean? A lot of great information, April. Thank you so much for being with us. We appreciate it.
Thanks for having me.
Keep up the great work. Okay.
Thank you.
All right. That's very interesting. California passed the pot law, but they did it by referendum. So therefore, nobody can run against somebody and say, "Oh, you voted for marijuana. We don't want that. The people overwhelmingly, as she said, voted in favor of it, the statewide election.